Hello, everybody, and welcome to our COVID-19 virtual town hall. Today is a special virtual town hall as we are in some great company of some of our fine first responders from the community. We have Deputy Chief Chris Chapinar from Coos Bay Police. We have Battalion Chief Steve Takis from Coos Bay Fire, Jeremy Pitts from Bay Area Ambulance. As always, we have Brian Leone, our public health epidemiologist, and Barb Young on the translation for our American Sign Language. So hopefully, if you are out there tonight, you've got some questions that maybe are more related to the first responders' role in how they've been working through the COVID-19 response from their end. We always will entertain questions that Brian can work his knowledge on from an epidemiology standpoint. So if we can get started when you guys talk, you can just kind of say what your name is just to give people some idea of your voice versus the screen. They'll see you in the corner once it pops up. So we will get started then with, we have a question from Brian Trendle, our Coos Bay superintendent. So one of our elementary schools has 2 staff who live with staff members from Shutters Creek. Should we be taking any extra precautions with these staff members? Hold on, let me unmute your microphone.
Necessarily be doing anything additionally. At this point, I would say no. Although, hopefully, if employees are working in an office setting still, most employers at this point should be having their own internal protocols for doing symptom checks and things like that. But as secondary contact right now, we would not necessarily be asking them to do anything too much more involved in that.
Awesome. Hit the button on that. Try it again. Talk.
Hello? Testing?
It doesn't look like it's picking up anything. This one is, so we will do this. Never a dull moment.
So
All right.
I should turn this one off.
Well, I don't know. For some reason, it is not showing on the audio thing. It was earlier today. I'm guessing that you broke it when you sat down.
Are you sure where it go? Got nobody making any comments yet anyway.
No, we're live.
Okay.
Okay, so for all 3 of you first responders, and I think you guys could probably take turns answering this because I would imagine that it's impacted you in separate ways. But how has the response to COVID-19 affected how you respond in general for your jobs?
So for us with Bay City's ambulance, it's added another level of questioning that starts even with dispatch. Whether it comes into the county dispatch or the city dispatch or directly into our in-house dispatchers, they're pre-screening patients before our responders are going out. So they're asking have you had coughs or fevers or been in contact with anybody that's a known case, and obviously that line of questioning has been pretty fluid throughout this and changed over time. But as we're pre-identifying high-risk patients, we're limiting the number of personnel that are making patient contact. We're changing the type of PPE we're wearing on a regular basis, all the way down to after the calls. You know, while we've always made sure we decon our equipment and our ambulances after calls, it's kind of added an extra layer to that. You know, we're not only deconning them between calls, we're doing a daily, real deep cleaning on all the rigs. So just heightened awareness, heightened levels of precautions, and extra PPE for the most part.
Steve, what about you?
For us, it's real similar on the medical calls. We're limiting people. One of the other differences with us, as far as limiting people, is we have our career staff, but we also have a group of intern firefighters that live at the station, and they work side by side with us. And with this and protecting them, we've had to limit their exposure even more. So typically on medical calls, they're not coming in at all unless it's a super critical call, and the extra hands would be helpful for us. And we've, in my opinion, throughout this response, we've worked a lot better with our partners. That's been a big change. I know Jeremy and I are in contact all the time, just trying to make sure that we're following the different state recommendations and things like that, but also providing a very efficient and sufficient response. So we've been in contact about, you know, if you get there first, then you do, you know, step 1 through 5, and if we get there first, we'll do it, and try and assess what the true need is for each individual patient, each individual call.
For us, law enforcement, we have kind of 2 different components. We have a dispatch center, so for our dispatchers that are taking the initial calls, as Jeremy and Steve both indicated, they have another line of questioning that they are asking the caller, so that way they can provide the best information they can to the first responders that they're going to be dispatching. So there's that layer. Then for law enforcement, we're really trying to just be smart on our approaches. We will oftentimes get the information from the caller, and if we can call them back instead of making face-to-face contact, we will try to do some of our initial investigations or gather some additional information via phone, or if we do have to have face-to-face contacts, we're trying to be as smart as we can about the way that we have that contact, maintaining social distancing if we can, having maybe somebody come outside as opposed to us going inside their house if we can do that. You know, if we're conducting traffic stops and whatnot, we may try to maintain a distance and maybe contact the driver on the passenger side to try to maintain some distance. So just stuff like that, making sure that our personal protective equipment is that we have a good supply of it, that our officers are using it. We're not utilizing masks on a day-to-day basis or on a every contact type of basis, but we do have masks available if needed. We obviously have gloves, and we're just making sure that our vehicles and our workstations and all those areas that we have constant contact with, that we're wiping them down and keeping them clean.
Awesome. We had a question from Debbie. She asked the question, I guess last week, and was regards to the positive case at Shutters Creek. She asked if the positive case in Coos County was the Shutters Creek inmate that has since been transferred out. Now, the 2 positive cases Coos County have both been at Shutter Creek and have both been transferred out. Is that correct, Brian?
Part of the entire state's Department of Corrections protocol for positive cases has been to medically transfer any positively confirmed cases to a special facility that has, you know, everything they need to take care of any positive case and make sure that they're well isolated. And yes.
Okay. So we have positive cases, and then positive cases go somewhere else. So,
yeah, but just like with any communicable disease reporting process, the case belongs to the jurisdiction where that person was living at the time they became sick and were tested.
Okay, another question for the first responders, and Jeremy, you kind of touched a little bit on from your perspective, but are there any normal programs impacted by COVID? And if so, how are they impacted?
As far as programs that we offer through the ambulance, yes, on the business side of it, you know, a large part of our business is what we call non-emergent transportation, wheelchair transportation, and non-emergent gurney moves, basically taking patients to and from doctor's appointments or discharging them from hospitals or long-term care facilities to their homes. And we've seen a drastic reduction in that type of activity since this started. In fact, down at least 30% on our side. So with the doctor's offices closed, nobody's going to appointments. So it's actually shifted the way we do some things. We're getting more and more involved with telemedicine and working directly with the primary care providers. We've been getting some stuff ramped up using Zoom and even FaceTime with cell phones, where we can actually go out to patients' homes and be the physician's eyes and hands with patients directly without necessarily having to transport them. So it's affected the way we traditionally have done business quite a bit. As far as outlying programs, you know, this time of year, you'd normally see us advertising and ramping up our lifeguard membership, you know, the ambulance membership. It's kind of been put on the back burner. We are still obviously rolling out the renewals for that, but you probably won't see us doing the big push and membership drives out in the community that we've done. So just know it's still available. If anybody has any questions about it, they can certainly call our normal business line anytime and ask questions. We are still open for business. People can come down to the office and talk to us if need be. We are trying to practice our social distancing there and keep everybody as safe as we can, but we are here to answer questions and help in any way we can.
Steve?
So I think for us, one of our big focuses has been maintaining our emergency response, maintaining the same level of emergency response that we've always provided. But what some people may not realize is that there's a lot of non-emergency things that the fire department does. We have smoke alarm install programs, we have car seat install programs, we work with the schools fairly regularly doing tours and things like that. So we've had to change how we do some of that stuff. So we haven't completely shut down any of those programs, but we've made a much better point of talking to anybody who calls for some of those services. So we had somebody call this morning for a smoke alarm install and talk through the situation with them to determine if it was a critical need and if we needed to get somebody out there and help them. And in this situation, we did need to get somebody out there. And we made sure we did some of those same screening questions that our dispatchers do when they send us to emergencies. We did that over the phone, and then our crews that went out there, they wore a mask to protect themselves and the citizens we were helping, things like that. We're also starting to do some recorded station tours. We started working on that this tour to be able to provide that. One of our firefighters who does prevention stuff did a little 3-minute prevention video that went out today. So we're still trying to meet the needs of our citizens on all the non-emergent stuff, just in a different way, not necessarily face-to-face.
Really for us, the programs that we have kind of stopped at this point right now is we stopped our Citizen Ride Along program. We stopped doing tours of the police department and city hall. Our volunteers, our reserve program, we put that on hold. Obviously, the reserves that are already sworn and already working in a sworn capacity, if we need them for a major critical incident, we need some additional resources, they will be available. But as I think Steve mentioned with his volunteers, we're not using them unless we absolutely need them. And then we have a volunteer program that enforces and monitors our disabled parking, some of our abandoned vehicles and stuff like that. And so that has been put on hold as well, just trying to limit the potential exposure of our volunteers. So that's kind of the programs that we've kind of put on hold.
Okay, so Brian, this question is more geared towards you. We had a question from David that said, if you've tested over 400 plus people and have only had one confirmed positive, this was like the day before our second one. Right. Doesn't that number seem much lower considering what the national average is? I plan to make a trip in the near future to your area, and this low number concerns me. Why are you testing so many people showing symptoms and getting so few positive results?
No, that's a really good question. Part of that number is likely, each state has their own recommendations for what the testing criteria should be locally for their state public health lab, for other labs, for maybe some large hospitals that may have came online. And of course, it's been well over a month now that private labs have been able to handle testing. And each of those labs may have different requirements for what type of criteria they're going to use. And so really the large amount of tests and the very few number of positive cases that we have could end up being a little bit of a mix of factors. Some of it could just be a little bit of chance. Some of it could be, the fact that there just hasn't potentially been as much endemic transmission in the area because we're a little bit more isolated. I think you'll notice if you look at the entire state, most of the coastal areas of the state are actually pretty low. They're also usually very rural. So there could be a few different things going on there. I would say, depending on the purpose of your visit, if that would be deemed essential travel, at least under the current orders for the state, that would be something to consider. But if those were to be lifted, or you did have an essential purpose for coming, I would not worry. We're spending a lot of time and a lot of resources in following up on any potential case where we know and are aware of a pending test, as long as we are notified ahead of time before we see that result. So I don't see a reason to be concerned there necessarily, although I do understand the point of the question for sure.
Well, to piggyback on that, we actually had a question that came in right after that, which how long does it take to get those results? Because at the point that this question was posed, we had 19 pending tests. So the question really is, how long does it take to get those, and do you have to send those tests out, or are they tests in our local labs?
So these are tests that are not done locally here. There is the potential that could be coming in the future. And again, when I say tests right now, I'm referring to diagnostic tests, not any currently understood rapid tests or antibodies tests that are not necessarily being used for diagnosis. But diagnostic tests, at least right now, are all being sent out, but they're being sent out to a variety of locations. And again, transit is not really the aspect of why a test may take 3 or 4 days to get a result back. The transit is actually very quick. And in fact, oftentimes if someone is sampled, say, at one of the hospitals locally here, that test will usually get to the state public health lab in the same day. And it's just a matter of usually a fairly quick turnaround time right now. I think most of what we've experienced is within 48 hours with the state public health lab. And even some of the private labs that at first when they came online were 7+ days to get a result. Even they're back down into the 2 to 3 day range often. So we're very encouraged with how quickly we're getting test results and not having to worry too much about folks needing to isolate.
All right, so another question for the first responders. What do you feel is your biggest hurdle during this whole COVID-19 pandemic?
Oh boy, for us, it's been adjusting staffing levels to the decreased call volume. hardest part about emergency medicine is being ready for what could happen, not necessarily what's happening right now. So we can't afford to waste the resources and have a bunch of people sitting around doing nothing. But we've also had to maintain the ability to up staff quickly as needed, whether that's because we have a busy 911 day or we had multiple out of town transfers, or whatever the needs are. But our people have been really good about being fluid with us. We're adjusting levels on almost a daily basis. Um, and our people have been troopers about it, thankfully. So they're answering the phone when we need them, and thankfully we've seen a little bit of an uptick in the last week or so, and we've been able to get those people back in and get them some work, but definitely staffing for us.
I think for us, there was two kind of bigger hurdles that we had to overcome, and I feel like it's leveled out since then. One of them was the PPE. So early on, when we all started looking at the stockpiles that we had, we weren't sure we had enough, so we started looking around trying to get more PPE, and that was very difficult because everybody worldwide was trying to do the same thing. So that was kind of a big hurdle, which I think we've overcome with the help of many of the local partners and Coos Health and Wellness specifically, being that point of contact to the state and get some of those state resources. So the PPE initially was a big hurdle. And then the other big hurdle was early on in this was the changes. So the recommendations coming from CDC all the way down were changing on a sometimes daily basis. So we would develop a best practice for our agency, our first responders, and then the next day or 2 days later that would change. So this was such a fluid thing early on that it was really hard to keep up with that and make sure that we did have the best information out there and the best practices out there. I believe that's kind of leveled out a little bit, and I feel like we're in a much better spot as it pertains to that now.
I think for the police department, I would echo a little bit of what Steve had to say. As far as initially, we had some struggles making sure that we had adequate PPE for our officers. That was a scramble because I think we had limited numbers, not only just in our county but across the state. So once that kind of started balancing out, I think we're pretty well set up in that area. So that hurdle kind of we were able to get over that one. The next one is just being able to still deliver a level of service to the community, maintain safety, maintain order. In times like these, oftentimes we will see an increase in some criminal activity, unfortunately. That's the reality. So when you see the increase in activity, criminal activity, generally it's in the areas of property crimes, public nuisance types of crimes, criminal trespasses, disorderly conduct. And we're seeing a decrease in the ability for the jails to be able to take those folks we take them into custody. So still being able to deliver that level of safety to the citizens and not really being able to carry out the same course of action we would normally do to help eliminate that criminal element in our city or county for that matter. That's been a hurdle. We're still dealing with that hurdle, and I don't believe that will really neutralize until restrictions are released a little bit. But so we're just balancing that. I'm just trying to make sure that we're out there responding when we can, responding safely, but trying to be as effective as we can on the criminal element side of things. So it's a balance for us.
Yeah, I mean, I think that makes sense considering the situation. We had a question that I think is kind of maybe more in your wheelhouse, Jeremy, maybe Steve. But have you seen increased calls for respiratory distress?
I think initially we saw an uptick in respiratory calls. It's kind of plateaued a little bit. I'm not sure how much of those initially were perceived as respiratory issues, as people's anxiety levels in the community, ramped up with the media coverage and that of this pandemic. Because quite frankly, not many, obviously none of them that we've transported in the community have turned out to be positive COVID-19 cases. But we haven't even seen a lot of truly sick respiratory patients recently. So initially we saw a pretty good flood of them, but I would say a lot of that was probably anxiety of the community themselves.
And I would just add that overall call volume is down. I think if you talk to any EMTs or firefighters in the country, I don't know if it's the same for law enforcement, but our call volume is just down. But it also seems like what people are calling for is more appropriate for the 911 system. It's not some of the lower acuity calls or things like that because people are only wanting the help that they need. And again, just utilizing that system a little better, I think.
So do you think that because of all the messaging that had gone out, especially at the beginning of this, about being mindful of the utilization of the 911 system and the emergency responders, that maybe people are taking into account, like, I really don't need to call 911 versus maybe before this they said, why not? And called when they wasn't necessarily appropriate to do so. But you seem to think that maybe people are actually more cognizant of why they're calling and using it appropriately.
I feel that way from the calls that were going on. We still have those outliers that just don't have any other resource, don't have any other way to get the help that they need, and may not need an ambulance right to the hospital, but lack of options put them in that position. But I feel like for the most part, whether it's all of the information that went out as COVID has ramped up, or if it's fear, I really don't know what it is, but I really feel like the people are using the 911 system more appropriately.
I would agree. I do want to stress to most people out there, the general public a lot of times has a hard time differentiating what is and what is not a medical emergency. I would just like to stress that when in doubt, call 911. Don't sit at home thinking, should I or shouldn't I? If you think you need an ambulance, call 911, get some help there. We would rather respond and find that you didn't need us than the other way around. If it is an issue that's fear related, I can't stress enough how much precaution we're taking in deconning and cleaning our ambulances. They're safe to be in. The hospitals are safe to go to. If you think you need help, don't hesitate to call us. We're here. We're happy to respond.
Question for each in the panel. That includes you, Brian. What, in your opinion, is the most important task ahead of us right now?
I'll still let first responders go first.
That's great. It's in the title.
It is.
Boy, the hot topic that we all see and we all talk about is when do we start reopening services? And from the healthcare side, I mean, that's going to be reopening preventative care, reopening elective procedures, and what's the right timing for that. So that would probably be what I'd be watching.
Yeah, I really can't think of anything that's going to be more pressing than that. Trying to make the right decisions on that, and I know that there's a lot to that. It's not just a magic wand that can be waved. And I know one of the big things, and it's been talked about in this town hall several times, is the role that additional testing might play in that, or some of the antibody testing, or these different things. But I don't know that there's been a real clear pathway put together yet. But how do we get it back to normal? And I guess what is the new normal after this?
Yeah, I think I would echo what you both said. When you were asking that question, I was thinking, well, I think it's going to be how we reopen and how we, it took us, I think I heard today it was 36 days so far in this kind of restricted state that we've been in. I may be off a day or two, but it's kind of taken us 36 days to get kind of where we're at right now. And I think on the reverse, it's going to almost be like a moving target at first, and how much do we open, and how much is too much or not enough, and just making sure, again, reassuring the community of their safety, our personnel's safety, just monitoring that. That's going to be the most difficult thing.
That sounds pretty good. Yeah, I would just add that there's certainly been a lot that has been sacrificed by a lot of different people in the community in order to mitigate the seriousness of the situation and to just minimize risk. And those sacrifices certainly, we don't want those to be wasted by starting to come back too early. But of course, we also want to balance a lot of factors. But I think ultimately, as long as we're using good sound judgment in terms of public health analysis and study and things of that nature, I think we're gonna be okay. We'll be able to find the right spot. But yeah, it's very complex. It's very a lot of moving parts. Like Steve was talking about testing, we sure would feel a lot better about exactly where we are at if we had a much broader testing availability than what we have right now. So hopefully that will be a part of that plan. Otherwise, you could really say that we're making some of those decisions with a little bit of blindness to it, and we don't want to do that. Like I said, we don't want to have the sacrifices that our community has made for the last 6+ weeks to have to be restarted all over again.
Well, and I think that's kind of one of the things that, like Chris said, that moving target piece, where we all have frameworks that we're going to have to work on. Like
Sure.
We as public health are going to have a 5-step framework. You guys, I think the law enforcement, you said, might be like a 3-step or whatever it is that we were going to be checking these boxes and understanding the growth rate of those cases.
Mm-hmm.
If we flattened it now, and then we start to release things, and then we see this like,
Right.
Top Gun type of straight up in the air thing with the numbers, then we're going to be like, whoa, maybe that was too much. But that again is like playing with the settings to try to figure
Right.
out what makes sense and what doesn't. And it's definitely going to be, as this response has been a community-wide kind of effort in order to get all of this resources going in the right direction. I think that opening is going to be very similar in that understanding on how all of these things work together to try to move that forward. It's going to be an interesting time.
Yep. Sure.
I have a question that says, do you feel like the citizens of the county are following the directives for stay at home and social distancing? I see very few people with masks, and I still see families going into Walmart.
So, yeah, why don't you guys talk about what you observed? Now, these are just observations. Yeah, go ahead.
I feel like there's more people following it than not. When I drive into work, I see less people on the road. When we're responding to emergencies, I see less people on the road, walking down the street, all of that. So I do feel that more people than not are following it. It can also be a little bit, if you're out and you see people about, it might be they're one of the essential workers. They're somebody that is going to a job that is still very important, and businesses that are still open and things like that. So I think that we're doing okay with it, from my point of view.
I agree. I think for the most part, I think the community has embraced the changes that have come about, and they have followed the governor's order. And I think for the most part, people are trying to stay home the most, best they can and stay safe and healthy. I think that you are going to see a certain amount of people that are out and about. Like Steve said, they may be out and about because they have some essential tasks that they need to accomplish, or they may be caring for somebody and they need to be in Walmart to purchase something for that person they're caring for. There's a lot of factors to it, but I think if you actually just kind of look around when you're in the stores, or if you're in McKay's or you're in Walmart or you're in 7-Eleven, you look at the signs and the efforts that the store personnel, owners, employees have put forth. They're putting signs up like that have been recommended. They're making sure that people are maintaining their 6-foot distancing, and I do hear them make comments to people if they are not following the rule, like say, back up a little bit, please, or don't put your hands on the glass case, and so I think for the most part, I think people are really putting forth a genuine effort. To be honest with you, probably more than I would have ever anticipated.
I've been out in public a few times. Some days I see the majority of folks wearing masks and being really strong about social distancing. Other times I still see the social distancing and maybe a lower proportion of mask wearing. I certainly don't want to discourage anybody in terms of wearing masks, but I will reiterate the fact that the recommendations from public health officials about wearing masks, regardless of your symptom status, has stressed the fact that that is particularly important in areas with a lot of cases. And so I certainly would recommend wearing a mask, but I certainly would not look at anybody walking around outside without a mask as going against any type of guidelines or orders, because as of this point they are still recommendations, and again, most stringently for areas that have much more illness in the community than we do. So
Thank you. Arnie has a question. Is public health involved in the antibody testing at Coquille Hospital? Will this have any bearing on immunity, or has immunity status been established yet? Oh, hold on.
that is a great question. So I wouldn't say we were involved directly in that testing process that Coquille Valley Hospital has begun, although we certainly have been in communication to kind of talk about, what are some of the things that we can take away depending on what some of the results are. And, as far as establishing immunity, I'm a little bit of a broken record sometimes when we just talk about how there's a lot of things we don't know about the illness, but immunity definitely is one of them. And while this particular test will be looking for IgG antibodies, which are the type of antibodies that are kind of that second level that take a little while for the body to start producing after infection, that's one of the reasons why they specifically say that you have to have been symptom-free for at least 2 weeks before we could possibly, consider the results reliable. And so what it's really looking for is not necessarily a marker of recent or current infection, but what it's looking for is there a possibility that someone has antibodies for this for one reason or another? That could just be from exposure. It couldn't, it's not even necessarily from an infection per se, but we don't know how long those antibodies last. For some illnesses, as soon as someone gets it, the body develops antibodies. Those antibodies stay until that person dies. For other illnesses, those antibodies wane over time. And so we don't necessarily know how long these would last, or the level of presence of those antibodies to be able to infer immunity. So there's still a lot of unanswered questions there that we'll hope to get answers for really soon.
All right, for our first responders, What plans are in place if a portion of your staff becomes unable to work due to COVID? Will response be impacted?
Well, for us, we make it a high priority to cross-train all of our personnel. Um, Everyone from our dispatchers on down to our mechanics in the shop are cross-trained as EMTs and operating on an ambulance or a wheelchair van. So if we did have, a portion of particularly our ambulance staff that were to become ill and unable to work, we could pull from our other departments and backfill those positions. We also have the unique, not sure what the right word for it is, but we're in a position where we're a part of a family of companies. So we do have work resources in other communities. If they were impacted differently than ours at any given time, we can shift resources around the state to make sure that we maintain that response level that the community here needs.
For firefighters in the county, there's been talks. The county fire chiefs are an organization that meet regularly and they talk about things like this. So even before COVID, there's plans kind of in place for this. If we need help, we reach out to our neighbors and our neighbors will help. So it would go along those lines. And those partnerships and agreements actually go all the way up to the state level. If you think about like a wildfire, if there's a wildfire in our area, it's not just the firefighters in our area that would fight it, it's firefighters from all over the state. But you start locally, you pull the resources from local and you fill what you can with that. And as you need more, you reach out a little bit farther. But yeah, for us, it would have to be a pretty significant impact to our staff for it to actually impact our response. I don't foresee that at all.
You know, I think the same would apply for us. I mean, we have mutual aid mechanisms in place where we could reach out to some of our agencies within our county and request mutual aid if it got to a point where we couldn't maintain adequate staffing levels to respond to our calls. However, that would take a pretty significant level of impact before we reach that level. We would initially, for day-to-day operations, we could restructure how we deploy our shifts. We can borrow resources from one of our shifts to backfill a shift that may have a couple officers down. We have some special assignment shifts that we could pull from and move them into a patrol capacity to where we can make sure that we're maintaining our response for day-to-day operations. It would take a pretty significant impact.
So, what is one thing that you would like your community to know about your response to COVID-19? And I think that all four of you can speak to this in different aspects of it, right? But what do you think the most important thing for the community to know would be?
For us from Bay Cities, the big thing is just to know that we're here and ready 24/7. If you dial 911 and need assistance, we're going to be there. We're doing everything we can. We've already talked about some of the precautions we're taking as far as robust decontamination procedures for our ambulances, making sure we have adequate PPE to keep us safe as well as the public safe, and just to make sure they know, in these changing times, we've worked tirelessly to make sure we're ready for if and when a surge of this illness hits our community.
I would echo what Jeremy said, that we definitely want everybody to know that we're here to respond, whether it's for medical, whether it's for a fire, any of the other emergencies that you might call the fire department for. We're definitely here to respond. But I would also want people to realize that we are doing everything we can to make this make the impact to our community as little as possible. So we have people in our agency many hours a day being part of different meetings, different different task forces within the county, all kinds of different things like that to try and make sure that on top of us responding for emergencies, we're also keeping this as easy to take as possible.
And the message from the police department is we are staffed, we are prepared, we are open for business, and we want the community to know that we are there for them if they need law enforcement. We are prepared to respond to whatever it is we need to respond to. We're adequately trained. We have the personal protective equipment necessary if we need to beef up some of that protective equipment. We have ways of doing that as well. I just just want to send that message out that we are there for the community, and we will maintain that level of response that the community expects of law enforcement. We just may be doing things a little bit different than what we have in the past, as far as the way that we may make that contact, or we may investigate that particular crime or that particular offense. So, but we are here, and we want to continue to maintain the safety of our community.
I would probably just kind of echo what they're saying as far as we're trying to do the best we've had to adjust the way we were doing traditional public health services. We've all had to make adjustments. The community has had to make adjustments. And the biggest deal has really just been, I think, for the vast majority of people here, we've all kind of come together as a community to work together really hard. A lot of our agencies have been in regular contact and collaboration since late January, trying to ensure that we were as prepared as possible. And I'm very proud of those, even the people who live here that aren't really involved directly in that response. We know a lot of people have sacrificed a lot to execute the measures that have been asked of us, and we appreciate that very much.
I'd like to piggyback.
To piggyback on that statement, is you've all mentioned that we've had to work within our community a little bit differently, right? So how has this response changed how you work with your counterparts in other areas? Like specifically in this situation, we've had a lot of the main groups in one room prior to the major social distancing, just to clear that up, to work together in a way that we really had never had to do in the past. So how has that improved how you do business or changed how you do business? And do you think that it's been beneficial for your organizations?
Well, I don't think I can stress enough that we've always had a great working relationship with our community partners, especially EMS and fire and law enforcement. But this has certainly brought that to another level. We're meeting on a more regular basis. We're making more unified plans on how to respond and how to keep everybody safe. We've been sharing PPE between the agencies, and even just sharing new ways of obtaining PPE as we've each researched independently. We've had to get a little creative with some of that. So it's been really, really good so far. It's taken what was good and just stepped everything up just to a new level of communication and partnership.
With us, I think it's actually been sharing of some of the workload also. If I had to sit through every meeting that there was every day for COVID, for all the different groups that we work with normally, we'd have to take all of our staff and just sit them in front of a computer. So being able to let Jeremy take the workload on some of that, letting some of the other responders that aren't in the room take the workload on some of that, to sit through those meetings, take the important information, and give me the cliff notes of it, of what we need to do moving forward. I think that has been one of the greatest things. And I would also agree with Jeremy that this county does have a really good working relationship amongst the different agencies that seems to get better all the time. And I think this just will add to that.
Yeah, I would echo with what both you guys said. I think community partnerships has always been extremely important for us in this county. We've always worked really well with each other. I think this just helps strengthen that bond. We've added some additional partners that I think they've always been partners with us, but now we have maybe a first name basis type of a relationship, or now I can put a name with a face and they can put a name with a face, and I think that's just going to help this community grow even stronger. We are now realizing the available resources that we do have here that we didn't maybe even know that we had, and the ability for us all to come together in a time of crisis like this and be able to really, I think, excel. So.
Yeah, I don't have much for a frame of reference. I just
Right.
moved here in November, so I didn't have a lot of experience in the community before, but I have been extremely impressed with the collaboration between all of the agencies in here, healthcare, all of it. It's been great to see. It's been great to be able to be a resource for people to call with concerns, questions, clarification. Yeah, it's been great.
I think that one thing that I've noticed, I've been with this part of the county for 5 years, and one thing I've noticed is that I know in those years, we've had quite a few collaborative efforts with Coos Bay Police, with our CIT program, and we've had things to do with the fire department, and we've had things to do with Bay Area Ambulance, especially with like the CAC meetings at Advanced Health, and really being at these meetings together and knowing who they are. And I think that may have been one of the reasons that our response as a community was so almost effortless in its coordination, because we already had an idea of what it was like to work together. And I bet that there is a significant amount of communities in the United States that did not have that as a framework and a base to work off of. So we're actually very lucky. And then I believe you're right, all of you touched on it at one point, it's really just strengthened the relationship that we've all had together, because now we've worked together in a kind of a crisis and know what everybody's capabilities are. So in the event that something like this were to happen, you already know what resources you didn't know about before, so now it's going to be much faster in that response. You also mentioned, all of you mentioned PPE to some degree. Do you have enough, and are you taking donations of PPE from organizations or groups that are making handmade PPE?
So I feel like for the fire department right now, for Coos Bay Fire Department, and even talking to some of the other partners, I think we're doing pretty good. There's a good channel of communication between our county and the state to help bolster those resources as they're needed. But I think we're sitting pretty good right now. I would put out there that there is a group of 5 or 6 fire departments that are helping collect PPE donations for Coos Health and Wellness, and we met a little bit today to talk about how we're going to disseminate some of that. But if you check social media out, there's some options on donating for anybody that would like to donate. If you're getting it to a fire department or one of the public agencies or hospitals or anything like that, we'll make sure it gets to the right people and goes to the right place. So.
Absolutely, and I touched base a little bit earlier. With Bay Cities Ambulance, we're fortunate to be part of a larger organization, which has afforded us the ability to share some supplies internally. One example is I may have one company that's got a large supply of this size of gloves, and we've got more of this size, and everybody can switch them back and forth. So we're doing very well on N95s and surgical masks and gloves and gowns, and we've been fortunate to have community members come forward that donated face shields and hand-sewn masks and hand-sewn gowns that we've got a pretty good supply of at this time. So.
Yeah, the same for the police department. I think overall we're doing really well. I think we have enough supplies, at least for right now, and been sharing our supply list and where we're at with the fire department. They've been helping us kind of manage those supplies, and I think right now we're doing really well.
I think the one thing any of us can't stress enough is with the current situation, we're all doing really well. If something changes, that could change very quickly.
Brings me to my next question. Regarding contact tracing, this individual is asking if there is a surge, like a major surge of cases. Do we have the ability to add to our staff to help with contact tracing if needed?
Yeah, I think so. You know, some of the individuals that are working on that right now, they were trained to do that basically right before we really started beginning doing that in earnest, and so and they have just done a fantastic job. I couldn't be more pleased with how they have done. I am sure there are other individuals that we could perhaps do the same thing with. Also, keep in mind that the level of investigation that we are doing now is not even required by the state in terms of getting some of that work done before there's even a test result. It's just been something we've been doing to try to kind of get a jump on investigations, because oftentimes time is very precious when you do that. So part of the thing about us not having cases has it's given us the ability to do some of that. And I'm gonna go. See you later, guys.
Oh, all right. Okay, so one more question for the three of you. How are your personnel doing during all of this? This is a high stress situation, and it's new to a lot of people. How are your people doing in this?
Well, our people have been extremely adaptive. We've already talked about how we're adjusting staffing levels on literally a daily basis. It's been, just like you said, very stressful for everybody, but our people have been fantastic. We couldn't be more proud of the men and women who work for us.
Yeah, I think that everybody that we work with is kind of used to the high stress, but this is different, like you said. There have definitely been some questions. There have definitely been some concerns, but I think that's been one of the best things about this is, like I said, there's so much happening, so much changing all the time. It's nice that we have employees that are looking out not only for their best interest, but for everybody's, and they're bringing stuff to us. Hey, should we be doing this? Hey, should we be doing that? So I think that overall they're doing very well, and they're being very resourceful throughout this, which has been very helpful.
Yeah, I would say the same thing. Our team is doing really well. I'm extremely proud of how well all the men and women that work for the Peace Police Department has adapted to some of the changes, and like Steve I think mentioned earlier in our discussion, that some of these changes have literally happened, maybe 2 or 3 different changes within 1 day or 2 days, and just being willing to adapt. We just really have had zero issues with that. We are used to working in a high stress type of environment. Law enforcement, first responders, and this is kind of what we do. This is something different than what we've faced in the past, but I think we kind of oftentimes thrive in high stress situations, and we learn to adapt, and everybody's doing really well with that. And we just want to kind of maintain that positive attitude that's happening around the PD.
Questions, how is personnel? How is what? Or how are the staff doing?
Resilient. Everybody has put in quite a bit more work hours than we used to here in public health, and but it's kind of one of those situations where when the need is greater, people that you want in your corner are the ones that are going to step up, and I couldn't be more pleased with how what I've seen from the staff here and in our communities. Sure, the stress is a little bit higher. People are working a lot of hours, a little bit less sleep, not perfect, but for the most part, it's just been amazing to see.
All right, and it's 6:30, so we've made it through our hour. It really flew by. I want to thank Jeremy and Steve and Chris and Brian for being here. You three first responders, it's awesome that you were able to come, and it's awesome the work you guys are doing in the community to try to keep us safe during all of this. And thank you guys for coming, and I hope we can do this again. For those of you out there listening, if you have any questions throughout the week or something that comes up that you want to ask us, please send us an email at covid19.questions@chw.coos.or.us. It's right there on the bottom right of your screen. Until next week, hopefully you stay well, and we see you again next Tuesday at 5:30. Have a good week.